Hello, my name is Ray DiGiuseppe, Director of Professional Education at the Albert Ellis Institute and Professor of Psychology at St. John's University. Welcome to one of our Master Therapist series. In these tapes, we will be showing live sessions of master therapists doing rational emotive behavior therapy. We have found over the years that therapists learn much more from watching a therapy session and modeling the behavior of the therapist rather than just watching workshops and reading books. Many trainees who watch therapy tapes want to know why the therapist made some of the decisions that they've done. They almost would like to get inside the therapist's head and think and listen to the conversations about why choose one intervention over the other. To help facilitate learning how to do therapy, we're going to have conversations with the therapist after each therapy session where we watch the therapy session and at key decision points ask each therapist why they made the decision that they did. Then the observer can see not only what the therapist did, but the ideas and the feedback and the information that they used in making those clinical decisions.
Janet, when you first sort of suggest the rational alternative belief, the client, she sort of accepts it, but you realize that she doesn't really believe it and it sounds a little wimpy, and you ask her, does it sound wimpy, and she does sort of acknowledge that she doesn't think she could buy it because it would make her be a doormat. Mm-hmm. You know, what would your plan be to how to handle this, to make the rational belief in a way that's acceptable to her?
Well, first of all, by anticipating, as I did there, her resistance, because I'm thinking in the back of my mind, she probably thinks this is really wishy-washy stuff. I checked it out, and sure enough, I was right. So again, I would go back to showing her how if she continues to hold on to the irrational belief, she's really going to lose power. She's going to lose in the long run. She's going to feel bad. She's going to get bad results. And to reinforce the functionality of the preferences versus the demand.
Yeah. And then it seems like you're linking the rational belief to behaving assertively, that you'll be able to behave in a way that's not so wimpy. Mm-hmm. So she can associate the rational belief with some other response.
And she has the dichotomy that a lot of people do, that either you shoot off your mouth and you show the other person what a rotten person they're being, or you squash your anger down. And I'm trying to show her that there is a third alternative, that if you moderate your anger enough, you can come up with a much more adaptive response, which is likely to get you better results.